Beep, 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 beep. Hello, welcome to the Court of the EDI Digester. What have I got for you today? Well, first things first, become a warrior teacher. Yes. March start. You know, one of those things. March start. So we're going to do something today that I hope you will find useful, that you can send to other persons who may not be aware of this, or the sort of thing that's going on. So hello to other persons, if you're one of those that has been sent this video out of the blue. I wanted this just to be something that's based purely in not just fact, but in medical terms. So what we're going to talk about today is really the effects of Lupron. Now, Lupron, for those of you that don't know, is a drug used to treat late-stage cancer, but it is also used as a puberty blocker by really bad actors in the gender ideology industry, and it causes no end of harm. So I wanted a video to exist where we have a statement about what those harms are, because I think that would be useful to be able to send to people. So there won't be much laughs today, folks, because this is bloody serious. And then on top of that, at the end of this video, you'll also find a small amount about the American Association of what I think is Psychiatrists, Ameripede or something it's called, which is where they've just released a statement this February, which I will put into the Dubris for you, which is devastating to the lies of gender identity ideology and the queer theorists that push it. So let's go with possible side effects of puberty. And this information was taken from the National Cancer Institute, talking about the side effects of these drugs, which are used for late stage prostate cancer. So common, some may be serious, means in 100 people receiving the drugs, more than 20 and up to 100 may have any of the following. And while I read this out, I want you to think about a 10-year-old girl or boy, or a 9-year-old girl or boy. That's what I want you to think about. All right, okay? Swelling of the body. Pain, such as pain in muscles and joints. Nausea and vomiting. Vaginal discharge. Depression and mood swings. Difficulty sleeping. Flu-like symptoms, including fevers, chills, body aches and muscle pain. Cold symptoms such as a stuffy nose, sneezing and sore throat. Swelling and redness of the throat and sinuses, which may cause difficulty breathing and swallowing. Headache, migraine. Flushing, hot flashes, increased sweating. Tiredness, pain, redness, bruising, itching or swelling at the site of the injection. I'll continue into the next category we have, which is occasional, some may be serious. In 100 people receiving this particular treatment, this would be from 4 to 20 would experience this. So the other one was 20 to 100, so anything over 20% will get it. And in this one, we're talking 4% to 20% are likely to get it. Heart attack or heart failure, which may cause shortness of breath, swelling of ankles and tiredness. Blood clot, which may cause swelling, pain, shortness of breath. Abnormal heartbeat, which may cause fainting. Change in the heart rhythm. High blood pressure, which may cause headaches, dizziness and blurred vision. Blockage of the airway, which may cause shortness of breath, coughing, wheezing. A cough. Anemia, which may require blood transfusions. Bruising, bleeding, delayed wound healing. Infection, especially when the white blood cell count is low. Damage to the liver, which may cause bleeding, blood in urine. Painful urination, increased urination, and difficulty urinating. Pain in belly, constipation, diarrhea, dehydration. Damage to the muscles, which may cause weakness. Breast tenderness, pain or change in breast size. Shrinkage of the testes, broken bone, bone pain, thoughts of suicide, dizziness, confusion, trouble with memory loss and trouble with memory, feelings of pins and needles in arms and legs, weight changes, changes in appetite, acne, rash and blisters, and a decrease in sexual desire or drive. Now that obviously is talking about the older men who have the prostate cancer rather than an 8-year-old. Okay, so let's get that clear. Right, now then you've got Rare and serious, in 100 people receiving Lupron, 3 or fewer. So for every 100 that take it, 3 are going to get this. Damage to a scarring of the lungs, which may cause shortness of breath. Scarring of the lungs. Low blood pressure, which may cause feeling faint. Seizure. Seizure. Blockage of the bowels, which may cause pain and vomiting. Diabetes. Allergic reaction, which may cause rash, low blood pressure, wheezing, shortness of breath, swelling of the face or throat. What I'll do is, I'll put on my timeline just after I've released this, which is, about 8 o'clock, 8:15 today. I'll put that image in a tweet so that if you want it for future reference, you've got it. Okay, so that's what I wanted to start us off with today, just to begin the conversation around this. And then there's another thing that's occurred that, let me just get it up, which is important, which is that acpeds.org, which is the pediatricians, I think it's the pediatricians in America, have released a statement on mental health in adolescents with incongruence of gender identity and biological sex as an abstract. And you can download a PDF of their statement in the Dubris, with the link I put in the Dubris. And it begins. Adolescents who have a gender identity not congruent with their biological sex have an increased incidence of mental health issues, including depression and suicidal ideation. Both before and after gender affirming care, GAT, they're calling it, adolescent, or gender affirming therapy, sorry, that's what they're calling it, adolescents who have gender identity incongruence are at higher risk for psychopathology than their peers who identify with their biological sex. It's almost like the insanity that makes you do it, that it is, causes insanity, isn't it? It's just madness. Previous adverse childhood experiences may play a major role in that psychopathology, and needs to be explored in helping these patients. There are no long-term studies demonstrating benefits, nor studies evaluating risk associated with the medical and surgical interventions provided to these adolescents. There is no long-term evidence that mental health concerns have decreased or alleviated under gender-affirming therapy. Many individuals who have been treated with gender-affirming therapy later regret those interventions and seek to align their gender identity with their sex. That's many individuals who've been treated. Many individuals. Not 1%. Adolescents who have a gender identity not congruent with their biological sex have an increased incidence of mental health issues. This is particularly serious given the exponential rise in the number of adolescents identifying as transgender in the past decade. Then there's some gems hidden away in the section on terminology. It says it's difficult to assess this topic without acknowledging the conflict over terminology. I mean, they're saying, the American Psychological Association here is saying there's such a thing as gender identity. I'm saying there isn't. I'm saying it's all a personality disorder. There's no gender identity, right? So transgender, they're saying, is an umbrella term that has so many things under it, it's pointless and useless. Both gender identity, here we go, and transgender refer to thoughts and feelings dependent upon one's emotions, as opposed to the biological determination of sex, which is based upon the genetic chromosomal composition of the individual. Biological sex is almost always easily identifiable at birth, if not before, based upon phenotypic expressions of chromosomal complement. Very rarely, in disorders of sexual development, additional testing may be required to accurately determine the sex. To describe sex as assigned at birth is inaccurate and misleading. Right. The American College of Pediatricians affirms the medical fact that the sex of an individual is based upon biology and not upon thoughts or feelings. The individual's sex is encrypted in every diploid cell of the body. Since an individual's biological sex is immutable from the moment of fertilization, it cannot be changed regardless of hormonal or surgical interventions. Nothing in this paper should be construed to mean the college agrees with or accepts that individuals can change their given biological sex. The so-called transition is not a change of sex or even a change of sexual or gender identity, but rather only a change in sexual appearance or presentation. Thus, transgender and transition are misleading and inaccurate terms. but are used in this document because of their unfortunate standard use in the medical literature. And there you have it. There's no such thing as transition. There's no such thing as transgender. There's no such thing as gender identity. The whole damn thing's a con. A long con by men. I'll see you later.